Welcome to the City of St. Louis Department of Health's virtual kickoff of our Bureau of Behavioral Health. In a few moments, Dr. Mati Hashwayo-Davis will discuss the work around establishing this bureau and the importance of the city of St. Louis and its region. Dr. Scott Timms of the CDC Foundation and the project director of our Overdose Data to Action team will then outline the plans for the Bureau and for his team as they lay the groundwork for this vital section of the Department of Health. And we want to take some time towards the end to take your questions through our Q&A box and our chat. We just ask that you please remember to be respectful of our panelists and the other attendees. And now I'd like to turn it over to Dr. Mati.
Hello, everyone. Great to see everyone on this call. Thank you for prioritizing meeting with us today as we start to do this really critical and important work for our region. For those of you who don't know me, I'm Dr. Mati Hashwayo-Davis. I'm the Director of Health for the City of St. Louis. So this, again, is our virtual kickoff for the Bureau of Behavioral Health. This really excites me because, you know, the Department of Health is committed to engaging the community as we work on preventing public health issues that negatively impact our community and promote the well-being of people who live, work, and play in our community. Sorry, 1 second. There we go. So I first want to thank you for your interest in the City of St. Louis Department of Health and how we are working to address behavioral health and mental health issues in our community. I want to be very transparent and honest is that the reason we did this is because I'm very well aware that while the Behavioral Health Bureau is new to the City of St. Louis and specifically the Department of Health, it is not new. This work is not new to you all. You are here because you've been identified as leaders who have been doing this work and prioritizing this work for years and years in the city and region. And so it was important for us to make sure that you were engaged in where we are in the process, the future, able to give questions and feedback as we move through this. I also want to be transparent in saying I'm very aware that with new leadership comes sometimes a recycling of things. Some of you have seen task forces and different initiatives in the city. A lot of you are frustrated by the lack of available funding and things of that nature. So I ask you to be patient with us because part of the reason I'm doing this in this way is that regardless of who is in leadership, whether it's me, another director of health, another mayor, that there's organizational infrastructure and pieces that will allow this work to continue. It's the very reason that we have brought together this team from the CDC for the first year so that the foundational work really puts down resources and again, infrastructure that will continue this work no matter who is sitting in this seat. So during this session, we will discuss the Department of Health's strategic plan, mission, vision, and core values to make sure that everybody understands sort of the background and the basis upon which we operate. We'll introduce you to our new bureau. We'll meet members of our Overdose Data to Action team and discuss their work with the Bureau of Behavioral Health. And we'll also spend most of this session asking questions and discussing your needs, sharing recommendations or concerns. So let's begin with the language that drives the Department of Health. And here I'm talking about our mission and vision statements. So our mission, we assure a healthy St. Louis through quality public health services and partnerships by providing continuous protection, prevention, and promotion for the public's health. We strive to curate partnerships that will benefit the community through data-driven direction and coordination. Some examples of this is our work with multiple partners for HIV and STI prevention, testing centers, violence prevention, and now this critical work around behavioral health and mental health responses. Which leads to our vision. Our vision is St. Louis, an equitable community achieving optimal health for all. We work to leave no St. Louis resident behind. Everybody deserves the right to adequate health care and the resources need to live their full potential. And I say this knowing that particularly Black and Brown communities and other minoritized communities have been consistently left behind. And so we are very intentional. In fact, when I went to the CDC and asked them to support this work in the middle of what I believe is a overwhelming disinvestment in public health at the national, Missouri being 50th in 2021 in per head spending, and the mayor and I only inheriting a budget for public health for 1%, I needed help. I needed help so that we weren't further delayed doing this. And we were given 6 salaried positions. You'll meet our fearless leader here in a second, and he'll talk a little bit more about this work. But equity and anti-racism is so embedded in who I am as a leader and how I approach all aspects of the Department of Health that I actually asked for a 7th position that wasn't offered to us, just around diversity, equity, inclusion, and anti-racism. So I want you to keep that in mind. I will be handing it over to our program director, Dr. Scott Timms, in a moment, but I also want to invite you. The chat is open for everybody to discuss. If it's not, our host will make sure it is momentarily. Please introduce yourself in the chats, ask questions, make comments. Let's make this as inclusive as possible. We will wait for questions at the end, so you can also use the Q&A box at the bottom of the screen to ask questions as we go. And anyone who asks a question, we will bring you up so that you can unmute and we can see you on camera, so we can make this as organic fireside chat at that juncture. So without further ado, I'd like to hand it over to Dr. Scott Timms.
Thank you, Dr. Mati. So I'm excited to, well, first, my name is Dr. Scott Timms. I am the OD2A project director. I'm very excited to talk to you about the new Bureau of Behavioral Health within Department of Health and the OD2A project. So I am very lucky to have an opportunity to lead this team and to talk about why this is so important right now. And I think Dr. Mati has really highlighted the importance of why this is something that we should be talking about now. But I'll highlight that the prevalence of substance use and mental health disorders in the city of St. Louis is above the national and state averages and has been rising consistently over the past few years. We know that when we look at any of the data that we have around behavioral health or in substance use specifically, typically the city is doing worse than the county or in our region. So that, I think, highlights the need for additional support. And again, we're not here to supplant, we're here to support work that's already happening and to be a coordinating force in that and an advocate for additional resources. And when I did this presentation last week, I had a lot of data in it, but I've learned that our community partners are very familiar with the data. So I'm going to skip a lot of that today, but know that when we share the slides, you'll be able to see some of the other data that we have been collecting as we're talking about this. So as we move forward into talking about the Behavioral Health Bureau, our goal with the Bureau isn't just to focus on treatment and recovery, but it is to talk about what we hope for is a St. Louis where every person can realize their own potential, cope with the normal stresses of life, and contribute to the community. So really taking a well-being approach. To require that vision, our communities have to promote well-being. So we have to start talking about it in more active ways and thinking about ways that we build our communities upon that foundation. When we seek care, we get the care that we need. And this component, I think, is critically important, that we're talking about community-based care where folks can, in their own community and with people that look like them, have access to care and treatments that are appropriate for whatever the ailment might be. I think that also requires us to expand our view of what care might look like. I know that we've been in a lot of meetings over the last several weeks post-gun, the shooting in the school, and talking about healing spaces and opportunities for communities to come together. And I think we have to talk about how we strategically place those so everyone has access to that. We have to have access to compassionate, integrated, and coordinated care. So how do we begin to get our primary care units to do substance abuse screening? How do we get them to incorporate mental health where appropriate? How do we create systems of care where you can be referred and you get follow-up and treatment? And so how do we strengthen those services? We have to act early and manage crises in the appropriate settings. And so, again, I think this is a little bit about how do we strengthen the prevention efforts that are happening? And then how do we always be ready to respond to a crisis? I have to say, being new to working in the St. Louis community, I've been extremely impressed by the amount of crisis response that we have available and how the community has rallied around the many schools that have asked for resources and support post-school shooting. I also think it's critically important that we have data to understand and improve behavioral health. And so setting targets, some things we want to improve, but also using that data to identify where the inequities exist, how we are addressing health equity appropriately, and also making sure that we're targeting where the problems are. So I think that data is critically important as we go forward. The Behavioral Health Bureau is being I've been working a lot after conversations with many of our community partners and our Department of Health staff about how we organize the Behavioral Health Bureau to get the most bang for our buck with these positions. I think it's also important to know that we've used the World Health Organization definition for behavioral health, but behavioral health is a state of well-being in which every individual realizes their own potential, can cope with the normal stresses of life, can work productively and fruitfully, and can contribute to their community. This includes mental health and substance abuse, but I think we have to also begin to think about behavioral health as not being just mental health and substance use treatments. These are things that we're doing, again, to prevent people from needing access mental health and substance abuse treatment. How do we build that preventive community base? So we are recruiting for a variety of positions within the Bureau. And so first of all, there is a Bureau Chief position. So again, if you're interested in any of the positions I'm going to talk about, please reach out. We're working to get these posted very quickly. But there's really going to be two arms of the Bureau as we look forward. One side will be focused on really health promotion and community engagement. And so that wing of the Bureau, so to speak, will be focused on community coalitions, prevention education, and communications, and working in a variety of ways and at different system levels to make sure that we have the supports that we need and that we're bringing people together in ways that are effective in helping us reach our goals. The other side of the Bureau would be focused on treatment and referral to care and that side, so linkage to treatment, care, and recovery. So really thinking about this as a two-legged stool right now, where we're bringing those two things together to help support the community and to do the work that we need to do. So 14 positions, we have all sorts of opportunities here, and we're really looking for strong public health leaders and folks who are interested in making a difference in their community. So again, please reach out if you're interested in those positions. So we've begun the work around the Behavioral Health Bureau with sort of 4 key tenets. One is to identify our community partners and create a space for engagement, collaboration, and support. So we've only been on board from CDC Foundation for about 6 weeks now, and I've been reaching out to people. I know after our meeting last week, I had a lot of people reach out, and I'm still doing follow-ups with that. So be patient, but myself and my team are reaching out to talk to folks, hear what the needs are, and how we can be supportive in this work. We'll be bringing people together through a coalition, and I'll talk a little bit about that later, but just know that there will be lots of opportunities for you to engage with us in this work. We're looking at new ways to develop and share data with our community about a variety of health issues related to behavioral health. We are looking to partner with schools to think about how we can advance behavioral health services for children, and how do we strengthen what's already happening there with our partners. And we're looking through at community collaboration to begin addressing substance use in the city. So substance use will be a huge part of our focus for the first year. OD2A is overdose data to action, so we focus on overdose and opioids, but I think we will do our best to support and lay a foundation for addressing the rest of behavioral health as we do this. So this is my team. I'm very lucky to have a really strong team from the CDC Foundation to help with this work over for the rest of this year. So I have a strategic planner, I have a diversity, equity, inclusion, and accessibility coordinator. We have an epidemiologist, a data analyst, and a program planner and assessment coordinator. So I'm lucky to have a really good team of people to help us do this work. Dr. Sherilyn Duckworth is our diversity, equity, inclusion coordinator. Nidhi Krishna is our epidemiologist. Ani Vartanian is our data analyst. Benita Gibb is our strategic planner. Rhea Contractor, assessment. And then Benson Adiyami is our program planner. So this team will be working. You'll be hearing from them over the next several weeks as we do this work, but I'm really excited to work with them and really appreciate the effort that they've put in. So overdose data to action has really a specific goal to reduce deaths through opioids through prevention, treatment, and harm reduction. And our second goal is to use data to describe the problem, target interventions, and evaluate effectiveness. Over the next 9 to 10 months that we're working in the community, we'll be helping reach these goals or laying the foundation for how the community can do this over the next several years. We have 4 big deliverables that we hope to bring to the community as we look at this. We will have in December a comprehensive map of services related to substance use prevention and treatment, and we'll be providing that in December. Our goal is to produce a document that also provides an EPI profile that talks about the data that we have available right now. That will lead us into our launching our dashboard in January, which is actually number 3 on this. No, I'm sorry, it is number 2. I moved it, but number 2 here is our deliverable is for a new dashboard that will launch in sometime in January. That will be a live dashboard that the community will be able to access and look at a variety of variables related to substance use and other behavioral health factors that we can pull. So we're looking at data. We'll be doing a listening and conversations with folks about what would be useful for you. I'll also say, like, we have an initial draft of a map of services that we've been working on, and we've been using the school shooting as an opportunity to pull in data and look at where we've been able to respond and how we're doing that. So again, looking at how we create this data and make it real-time available for use in the community. Our third deliverable is a strategic plan that comes with an implementation plan on how we're going to do this work over the next several years. So in December, our coalition will start meeting, and we're going to look for all of you to be part of that so that we can really develop a good plan that addresses gaps that we've been able to identify and to address opioid and substance use. And then fourth, we will provide a health equity roadmap later this year that really looks at health equity issues and how we begin to address those and laying the foundation and work for that. So 4 really big deliverables that we'll have for the community, and we're excited to bring those in. So right now we're in our introduction phase. So you've probably seen a couple of emails from me asking you to complete a survey. That survey is open till 5 o'clock today. So please provide your data if you haven't. It's really exciting that I think we have over 50 responses right now to that. Some really good data that's going to allow us to create that matrix of services to help us identify gaps and opportunities for intervention through our strategic plan. So please take note of that. Later this week, after that survey closes, we're going to send out an email with dates and times for our coalition meetings and inviting all of you to be part of that. We are really looking for leaders who will help us with this work. So if you're interested in that, please reach out and know that we are trying to respond to emails as quickly as we can, because we've had so much response to the survey and our introduction of the Bureau and OD2A. Our second phase will be the St. Louis Opioid and Substance Use Task Force, or SOS for short, which we see as a collaborative cross-systems approach to combat the impact of substance use on families in the community. And so this will bring us bringing together our community partners and having conversations about what we should do to address opioids and substance use. Now, I'm not starting over here. I know that there has been a ton of work that's been done in the community, a lot of strategic planning. We want to build on that. If you have older strategic plans or works that you've been doing, please share those with us. We want to have a conversation with you because we really want to build on what's already existing. There's a lot of work happening in the community, a lot of really good work. So we want to look at how we build on what's happening and identify gaps to address where we need to do more. We want everyone to be at the table. And so we've been very intentional about how we're putting the task force together to provide ample input for our smaller community-based organizations, our state agencies, our city agencies, and the like. So just know that we'll find a place for you there. Please reach out. Our goals are, again, to create that strategic plan for the city. We want to also create and think about a structure for continued monitoring and implementation of the plan. One of the things that we've heard consistently in our early conversations is that there's been a lack of implementation in previous strategic planning attempts. I think COVID had a really huge impact and a lot of things got lost or delayed, and we're looking to build on those. But know that we do recognize that we need to have a really strong implementation and sustainability plan. We also really want to think about how we build capacity across the community to address substance use and overdose deaths. So it can't just be the Department of Health, but how does the Department of Health build that capacity with other agencies and partners to continue to do this work? Our task force will look like this. Again, a variety of folks are going to be invited to be at the table, and we're excited to have you there. Again, we have what we think is important. We also are looking for you to add, so don't be afraid to bring different ideas and new initiatives to the table. And again, we're focused on substance use because that's our funding source. I do think that this is a conversation we have to have about behavioral health as a whole. So it's not going to be just conversations about how we provide Narcan to the community. I think we should also be having conversations about how we do substance use education in the schools. How do we do outreach to communities that have generational trauma? How do we do those things that will, at the end of the day, reduce substance use and overdose deaths? Phase 3 is where I think we're going to be doing a lot of work really quickly because of the time frame of our funding. So in January, we will launch our dashboard. In March, we hope to have the first of 3 community summits, where that first summit will focus on capacity building and the strategic plan launch. We'll have another summit in April focused on health equity. And our third summit will be on implementation and sustainability of the work as we go forward. We have a summit planning committee on my team that's working on this. We'll be reaching out in the coming months and asking for some community partners to work with us on that. We really want to rely on local talent to help us come in and talk about best practices and opportunities, because we know that there's a lot of people been doing this work and that have really good knowledge to share. So I talk a lot, I talk really fast, and I hope I covered this for you. We're going to open it up for questions now. And so I think Kim will help us identify questions. We're happy to bring people forward. I know Dr. Maddie's probably been watching the chat for Q&A. So I'm going to stop.
Thank you so much, Dr. Tim. That was phenomenal. And I always get excited when, this is my second time hearing you do your portion of this, but it excites me because, again, the long-term investment in our region is so rich. At our, you guys are a lot more polite than the first group, in that the quick Q&A was already jumping and hands were already up. So Michelle, if we can bring Michelle Schaefer forward, we'll take her question first. But I did want to talk about some themes that came out of our first launch night that can maybe help to spur discussion and other questions in the chat. I don't want this to be sort of an ego feeding, just very surface level discussion. I'm happy to get into the weeds of things. And one of the things I was very transparent about is that it's important to me, especially from an equity perspective. I've only been in the St. Louis region for 7 years. And although I'm a Black woman and an immigrant, it's not like I'm a daughter of St. Louis, right? The CDC team are all from outside. Scott, as a leader, identifies as a white man. And we have, it's important that you know that while the infrastructure piece and the building piece is going to be done by these teams, we center and prioritize the leaders who have been the trusted messengers, who have done this work. And we want to be thoughtful through the task force and other long-term sustainable initiatives to make sure that when it comes to the actual leadership, I don't need to center myself, neither do my team need to center me. We see ourselves as conveners and leaders and facilitators of the leaders that have already been identified, and working in partnership with you. Sherilyn, that's really important to Sherilyn. It's part of the reason why she's on the team as well. There'll be a lot of in-person virtual meetings, talks to discuss how this evolves. But I did want to address that elephant in the room and maybe hear more from you all about how you'd like to see that configured. There were questions around funding. I got 14 salaried positions and no operational budget. You will hear breaking news that the opioid settlement is coming close to completion. So I'm hoping we will see those funds. We were able to secure $400,000 through June of 2023 from DHSS. But we have not been told that that money will be long-term. That goes year to year. I have asked for support through ARPA funding, but I won't know through December how much money in that ARPA funding goes through to 2026. And I have in my, as I'm trying to hire a full bureau of 14 salary positions, we're also going to be prioritizing a full-time grants manager so that we have someone on staff that's constantly looking for monies. Obviously, I need more investment in public health so that we can drive funding and budget. Grants, as you all know, are subject to what they're doing and have strict requirements. So what I'd like to see us is grow the internal budget. And at that point, RFPs and notice of awards and applications will go out. In equity, I would like to build into RFP processes consultants that are available to help smaller organizations that don't have capacity or support to apply or to do the monitoring. While I'm happy to put monies in the hands of people in the community, we fail audits and lose money when we don't have the appropriate monitoring reports as well built in. So we need to find a way to empower the leaders that we want while putting DOH in a position to continue to get funding for this work in the region. So these were two of some of the other big things that came up at the first meeting. Michelle, if you could unmute, introduce yourself and your questions or comments, please.
Yeah, sure. So I'm Michelle Schaefer, Regional Vice President of Behavioral Health at SSM. thrilled to be here and talking to Dr. Motti and Dr. Timms and everyone today. Dr. Timms, just as you were talking through some of your presentation, it occurred to me that, and you may already be doing this, it just was really my question. There are convening or gathering groups. So for instance, Behavioral Health Network has a lot of providers together. I'm sure that I know that there's a group through 24/1 of clergy that are together. So I'm wondering if you have all of that information, it might sort of just cut down on just the amount of work that you have to do to get to teams to get the information that you need, and then also deliver messages back in terms of what you need from all of those types of groups. So I was just trying to think, as I am listening to all that you guys are trying to do in a very short period of time, how do we as folks participating in this help you with that in a way? And I was just thinking that in terms of multiple convener groups that I know about.
Yeah.
So can I just go quick first? I wanted to thank you, Michelle, because I love leaders. It was really wonderful for Scott and I, as we were debriefing from the first meeting, to hear how many leaders came into this space from a place of how can we help. And I think that people also need to know that I did an almost 15-person listening tour with leadership from BHN, DMH, Mental Health Board, and other entities, to really inform where do they want to see me and Department of Health positioned in this work. And we heard overwhelmingly two main places. One was as a convener to help with the siloed approach, and the other was around sort of validating mental health resources and providing a one-stop shop for the city and region, as well as helping with the ongoing work that you all do to coordinate services in different places. So I just want to thank you, Michelle, for constantly being a leader who shows up from a place of how can we help, and for bringing solutions. It's really helpful. Scott, if you could address some of the feedback that she just gave.
Yeah, no, thank you, Michelle. I will say that I have been invited to a number of those meetings that you're mentioning, and I think there are probably others that I would love to go to, because I think you're right. And I think that's one of the sustainability pieces as we talk about coming up with this initial plan is there's a lot of work happening. How do we create a structure that's sustainable without adding another meeting or another layer? And I think those are good conversations to have. So I'd love, if you have a list of all those meetings, I would love to see that. And I think you're one of the people I'm meeting for the first time. So email me. I would love to have put some time on my calendar so we could talk about it and make sure that I am at the right meetings or I get some staff there. I'll give a shout out to BHN, who has been wonderful in inviting me to meetings and different councils. And there are a lot of really valuable things there, but I'm sure there are some that I'm missing, and I would love that opportunity. So I did that.
I'll absolutely send it to you. And one of the things that I'm really hopeful for out of this place, that it's an advancement, right? Because there's BHN, there's 24/1, there's, as we mentioned, a lot of different groups, but I can tell you, we don't always work together between those groups in communicating, right? And so that is something that I think the Bureau could lend to all of us in a very strong way, right? That it's collectively bringing them together. And yeah, a lot of people sit on a lot of different ones, but at the same time, there's still some siloed, not the right kind of connectedness. So
I totally agree. I think, Michelle, one of the pieces that I'm seeing that disconnect is between like true primary prevention and care and linkage services. Like, it feels like when we think of prevention, we're really thinking about tertiary or secondary prevention, like it's after somebody's had an issue. So how do we really start talking about those groups before they get to the point of needing treatment? And so I think there's a real opportunity there. I also think that one of the places like that, I think, is if we're talking about just general community well-being, Like, we really are so focused on the response and crisis. Like, we need to put some energy into that before the crisis event happens as well, because I think we're not, those are things, and that's not unique here. I think that that's in any community that I've worked in, but I think we have an opportunity with this new bureau to help fill in some of those gaps that you're highlighting and create a different conversation space around it. So thank you for that. I also just added my email address, and I also have a link. So if you click that link and you want to talk to me, you can find a time on my calendar. Tried to make it really easy, and I'll be honest, like, I'm behind on emails because I've had so many. So please take me up, and I'd love to have a one-on-one conversation. So
we have a giant in the field who is so committed to this work that he's come to both meetings and has put what I love as a comment in the chat. If we could bring forward Joe Yancey, please, we would love to hear from you. I think you really helped spur discussion at the first meeting, and I would love it if you could come up. If we could also, I just want to acknowledge Craig, who needs to log off, but who talks about the near monthly Let's Connect meeting, which has a lot of providers. Thank you for bringing that into the space. We are in communication with Grow STL with Steve Parrish. He was at the first meeting, so thank you for those as well. And Steve, if you want to reach out to or take the link that Scott just provided for follow-up meetings with him, since you have to go, we would welcome that. But in the meantime, we will see if Joe Yancey is available to come up just to share some insights and thoughts. Thank you, Michelle, for your, again, for your comments and your willingness to support. And there he is. Joe, if you would mind just introducing yourself, although I don't think you need introduction to anybody on this call. And if you could talk a little bit about your experience in the first call and just talk about your comments that you just put in the chat, and anything else you want to add, would be appreciative.
Yeah, no, again, I think I'm just excited and happy, and I was particularly happy to Dr. Timms hear your beginning. I think that you incorporated, which is really what I was trying to say in that chat, some of what was talked about in our last meeting. And again, I think that it's just that it's critical that we recognize respect and get insight from the people that live in those communities, whatever community it is we're working in, that we understand that. And in particular in Black and Brown communities, I think that is even more critically important. And so that's kind of what I was hearing through that, through what you were saying. And it's, we're also addressing and need to understand that this whole concept of wellness, which I totally agree with, that is a goal, that's a North Star. And should be for all of us. But what we need to understand is how foreign of a concept that might be, simply because of, again, individual and community generational trauma for a whole host of reasons. But also just kind of, again, what we kind of talk about is, health literacy is short in so many of our neighborhoods that are most affected, and communities need less behavioral health literacy. So we have to bring into community this, we have to make it for real, like a neon sign, so resources, which is always going to be a problem. And I hear you, Dr. Mahdi, and I know I get where you're at with that. That this whole concept of overall health, which includes behavioral, which I think a lot of times is a predicator to physical issues, but and that's all what health is, and so that infrastructure and that capacity, but it has to be, in my opinion, respected in the sense that the insight, the knowledge, the leadership and ownership to some extent, it becomes embedded. So those are my thoughts, Dr. Mahdi, for what they're worth.
They're just so good, too good. I thank you for reminding me about the health literacy conversation, because it's something that nobody had brought up until you did, and that is so important and isn't talked about enough. And so Dr. Timms and I in our debrief made note that we want to include that in all of our, in the strategic planning portion of this moving forward, and talk about it, its implementation in all programmatic rollout looking forward. I really, really appreciate how you've been intentional about coming to these forums to talk about the community efforts and those leaders, right? To talk about how we can empower them while there's challenges in the seat I sit, and making sure that they're honored appropriately and that those revenue streams are sustainable and ongoing. That's been something that's important to me, and I'll be reaching out to you for guidance and mentorship as we continue to grow. The capacity and infrastructure piece to me is so important. And then again, addressing that generational, individual, and community trauma. And you and Dr. Punch, who was at the first meeting, I think did a beautiful job of bringing that to the fore. So I really appreciate it. Thank you again for being a leader who's done this work for so long, has stuck with it, and will continue to come to you. Anything else you want to say before we move on? And I've asked the moderators to bring Kimberly Jones, Joe, or things that you think are important for us to think about by way of solid deliverables and next steps that you'd like to see? Joe?
Well, I think we need to start to potentially think of who and how we go about trying to develop those partnerships.
Right.
And again, I think that's got to be not necessarily the usual suspects, but a very intentional and thoughtful process of how that bi-directional critical communication and I believe leadership should occur. So
yes, and I love
that's
that.
my only thought.
There's two pieces to those deliverables, and we're recording this, taking note, and Scott and I will include in our debrief. So very much noted. The comms piece is one that I love that both you and Michelle brought up. And I think we have the infrastructure here through our communications, health promotions, and public information officer team. And I really want to shout out, if you look at the people introducing themselves, there are more than one of our partners in the county. That speaks to the leadership in the county. They've had a thriving behavioral health bureau for many years. They do a lot of work with all of you, but they showed up for the city, and behind the scenes, they are constantly in communication. Kate and I, Dr. Cunningham, who's now joining the leadership, we talk via text informally all the time. Anything I need, they will send me. But more and above that, when I took this job just over a year ago, I reached out to the county and I asked them to do a monthly meeting with me and our board of health. We have been doing that monthly, and we have created new partnership collaborations and joint policies in ways that public health has not seen before. So I see a real opportunity for collaboration, and we want to then meet with the county leaders to make sure that we understand exactly where they are in this space. And Dr. Timms has already started some of those meetings, but we'll continue to have more so that we can continue this work and make sure that it's in alignment with what they're doing as well. I think the opportunity for our communications teams and PIOs who have worked together and do so well will provide a really great resource to the partners and the leaders that you're talking about as the first deliverable really shoring up, so that we have that centralized communication that you and Michelle spoke to. Does that make sense, Joe?
Absolutely, no.
And I really see Michelle is getting excited in the chat about that connectivity and alignment too. So I'm glad that's resonating.
Okay.
Thanks again, Joe, for coming to both. Your commitment to leadership here is so much appreciated. Brian Quick is asking if we have connected with Homegrown STL. Yes, peripherally, but not in a very real way. We would love to. Dr. Timms has them in his sort of Rolodex of people to meet. I want people to be patient with him because he needs to actually do the work of getting through these webinars and the survey data collection, and then he'll be in a formative stage of meeting with those of you who've asked as well. But thank you for bringing Homegrown to the table. They've been doing such important work in the region. Kimberly Jones, if the moderators have been trying to bring you up, I'm not sure if you're not comfortable, if you're having issues, so you can either unmute Yeah, you can unmute if you're ready now, come on camera or in the chat. So Kimberly, over to you. Kimberly, if you're speaking, you're still muted. And I see a phone number coming up, so we'll just give a few more seconds for Kimberly to maybe unmute or use the phone function that may have just come up. We have about 15 minutes left on the call. If there's others who want to come up, discuss, or put in the chat, please use this opportunity to do so. I don't see any identified questions in the Q&A, but a lot of positive feedback in the chat has been really rewarding, and the discussion so far rich. Kimberly, are you able to unmute?
So Kimberly is not here. Good afternoon. This is Rashonda's
Hi.
project director. Hi, how you doing?
Good.
So I gotta call me off going. So Kimberly is outside setting up for our neighborhood outreach here in Baden.
Okay,
And
great.
so, she wanted me to listen in, and I'll go back and review everything since I typically oversee all of the programming here in reference to community and our opioid initiative. So at this point, no. Joe spoke well of everything that we're a part of as being a part of Grow STL. And so at this time, no, but thank you.
Thank you so much. And thank you for being here. I just love that the leadership is out here actively doing the work, which is why you're having to attend. And I'm glad that you resonated with what Joe said. It was powerful when he talked on last week too. So I think that's a constant theme, and we're very clear on what you all want from us and need from the city moving forward.
Thank you, and it's good to see you again.
Good to see you again. So Stephanie, if we could bring Stephanie up, I'm loving this chat. She's excited to see how this continues to evolve. Doesn't have any questions. Have some data related requests. More data that breaks out by ages would be wonderful. We have an identified data analyst, epidemiologist. I grew our data and epi team from 2 people last year to over 10 and a full unit right now. So we're in a really good position about data. In fact, look out for mapping that Dr. Timms and his team have done around where we have been doing with our partners around the tragic school shooting, where behavioral health resources have been brought so that we can then use that to inform longer term efforts. So I think that would be great. So I love that you're asking for data by age and have some granularity there. You're also asking for data available related to access utilization services. I think that we're totally in alignment. And sometimes groups like older adults may not always show up as high prevalence for behavioral health needs, but do show inequities in accessing and being successfully supported. I love that. We've joined in the conversations with the aging, I'm forgetting the exact name, but the aging leadership committee that's convening leaders as well. And then for mapping, we are definitely aware of the work that UMSL and Rachel Freeman and others have done. And so we want to be in alignment with them and grow upon that work and not like leave it out. So really excited about that. Stephanie, you're here now. I read your stuff, but I think you can say it better. So would love to hear what else you have to say and areas that you'd like us to be active and maybe collaborative around the data piece and other things.
Yeah, I mean, I don't have too much more to say. I do appreciate, I know you've been supportive of and had members of the department as part of the Aging and Behavioral Health Network meetings that have been happening. And I know there's a lot of providers have been really supportive and interested in exploring how they can better serve older adults as they recognize a lot of their clients are living longer because they have had a lot of supportive services, and so sometimes there are some unique aspects as we age to consider when we're also addressing behavioral health needs. So anything that we can do at the St. Louis City Senior Fund to be supportive of that, and as well as the groups that we're a part of, we definitely want to help.
So excited by that. Please set up some times with Dr. Timms in the future so that we can make sure that especially the aging population is not left out of this. And if there's specific like priorities and programming that we need to prioritize, that would be great, because that's the first comment in both of the meetings that we've heard specifically, and I couldn't agree with you more. And that it's a nuanced discussion. It's not like this monolithic piece. I love the fact that you could get data that reflects, you know, outcomes in one way, but may not really speak to the access point. You know, my good friend, Dr. Corey Bradley, many of you have heard me say, data is justice, but a community leader actually pushed me further, because especially in academic circles, we love to weaponize data, but if it's not really informed by the communities that we serve, we don't really have the questions and therefore the outcomes that can speak to data, because you can really skew data to say whatever narrative you want, right? So if we're really here around equity, we need to start off within those communities, figuring out what those metrics should be and how we support it, and understand that it's not monolithic, even within minoritized communities and aging communities as well. So thank you for that, Stephanie.
Can I add, I think, Stephanie, or for any of the other folks that are on this call, one of the pieces that will make or break the dashboard and its usefulness is our access to data. So if you work at an organization that has a large data set and are willing to work with us on sharing that data so that we can use it for this purpose, it's helpful. We're limited by what we have access to, and I've been talking to several of the larger agencies about data sharing. And so if you have resources to share your data with us, that would be really helpful, because sometimes it is just us being able to get access to the raw data so that we can put it on there. So please keep that in mind as we're meeting, because it would be really helpful. So. I see Kimberly, or whomever is in Kimberly's face, has her hand up again. You have a.
That was a mistake.
That's okay.
I didn't know if her
Okay.
camera is on or not. It was like, here, you're a director of projects, get this. So I'm sorry. I don't even know how
No, you're
to navigate
good.
your phone at this point. You know,
You're
this is
so
good.
good.
I'm enjoying it. So
You are so good, sis. And it's just good to see people show up for us. These numbers are overwhelming. I think in total, with this week and last week, were over 80 or even closer to 100 participants. That says so much about A, the excitement around this work, and B, how you show up to support us. And that doesn't go, that means a lot to us, because it doesn't always feel that way. You know how this is. And I think it's important that we tell these stories to the rest of the community, because they need to know, number one, the priority in public health. I think this is a time for us to use behavioral health to help invest more in public health, and specifically in behavioral and mental health, and for them to know that we are so aligned and so partnered. And so, yeah, this is exciting. Any closing thoughts or questions? I'm happy to give people 10 minutes back of their day if that's what people would prefer. But if there's anyone who'd like to raise their hand or say anything in the chat before we release you. So Dr. Timms, if you could put your email address and that link to how people can schedule with you again, that would be great. We will send the PowerPoints from today. Again, it will be more beefed up with a lot of the data that we included in the last presentation, but we wanted to make sure we had more time for discussion this time, so you will be able to see those, share them widely. We want feedback if you've had time to process and you have other things to say. And then just next steps are our teams will be working to really synthesize all of this feedback, really work on the survey. Scott, if you could also put a link to the survey so that anyone who hasn't had a chance to respond to the survey, which is a needs assessment, we can please prioritize that. Has that closed already, Scott?
It's closing at 5.
Okay, so
Give
you
me a
can
minute
work
to
on it
find
today.
it.
We did send to everyone, and we extended it. So please, if you haven't had a chance, you have through 5 o'clock today. Michelle, thanks again for the encouragement. Together, we are going to do amazing work in our city and the community. I couldn't agree more. And in the region with our county partnerships, couldn't agree more. So please check the chat. Dr. Timms has put his email address. He's put a scheduling link there as well. And then The email for the survey went out a few days ago, and we could include that with the PowerPoint stuff when we send that out if it's hard to put in the chat right now.
I would just sort of say if anybody needs the email link for the survey because they didn't have a chance to do it, email me directly for it because I can't find the link
Okay.
easily. Sorry. I found it. Hold on. I do have it.
It's organic and it's live, folks. We're just doing the best we can. All right, for those who have to go, you can go. I'll hang on for a few minutes in case anyone wants to hang out or needs to get the chat. You'll get the recording, and with it has everything in the chat as well so that you can share that in your networks. Thank you for joining us and supporting us. We look forward to giving you more as this unrolls.